Hi, I'm Dr. Bill Berkowitz with Life Chiropractic in Grass Valley, California. I want to talk about upper cervical care. And I want to give you 5 critical questions that you might want to ask of a practitioner if you're looking for upper cervical chiropractic care. First, let's address why you might want some upper cervical chiropractic care. The upper cervical spine is key to maintaining balance in the head and therefore balance of the rest of the structure of the body. When the body's out of balance, it's working extra hard, and that produces pressure, tension, wear and tear on the joints, as well as irritation, interference, and tension on nerves. The upper cervical spine is home to the brain stem. That's where the nerves that come out that go to the vast majority of your internal organs go. That's the autonomic nervous system that controls heart rate, blood pressure, digestion, breathing, immune system, the regulation of sleep, and keeps the overall tension and pain at a minimum in your body. It's also home to the suboccipital nerves. There's 3 pairs of nerves, 3 on the right, 3 on the left, that come out of the upper neck. One nerve goes into the back of the head, one comes all the way around to your forehead, and one goes into your temple. This is a common cause of headaches. This is also a place where you might develop sinus problems. So also, just as a broad concept, the nerves that pass through the upper cervical spine are the nerves that go everywhere in the body. That's the communication pathway between your brain and your body. So it's a critical area. So here are 5 questions that you might consider if you are looking for upper cervical care. One is the technique on the really gentle side or more forceful. There are upper cervical techniques that involve barely touching someone, and then there are techniques that are more associated with traditional chiropractic. This is as much a preference, but it also points sometimes to efficacy. So you might want someone that does both. Second question is, are the adjustments done by hand or instrument? I'm not going to get into a debate about which is better, but again, this is something that you might want to consider. 3, are x-rays necessary? And what does that involve? And you might even want to ask, are you going to take repeat x-rays, and on what kind of frequent basis? So that's just something that you might want to consider. 4, do you adjust other areas of the spine, or are you limited to only the upper cervical spine? In my experience, I've met people that have been to upper cervical practitioners and then have to go to find another chiropractor to get the rest of their spine adjusted. So you might be looking for somebody that handles both. And then you might want to ask the 5th question is, if you're adjusting the rest of the spine, is it by hand or instrument? Maybe you have a preference. I've grown to really deeply appreciate the upper cervical spine, and it's an area that I assess with every single person that comes into my office. And yes, sometimes there are people that it might be better served by somebody whose practice is limited only to upper cervical chiropractic. Make sure to subscribe to my social media channels where I actively post about a range of health topics. Also, go to my website, Life Within Chiropractic, where you're going to find a lot of great information. And if you're interested in scheduling an appointment, there's a scheduling link on the homepage. Thank you. Have a wonderful day.